Good afternoon, everyone, and welcome to Office Hours with Stephen Tweed and other members of our team at Leading Home Care, and it's great to have you with us. This is a informal opportunity for our clients, our customers, our readers of our newsletter, and other friends around the home care industry to come together and do a little update on what home care companies are doing to cope with the coronavirus. And today we're going to dig into some of the latest information that we've gathered in the last week. I know some of you have been with us for a number of weeks, others, this is your first time being with us, so welcome. We've identified a couple of issues that we're going to be focusing on, and then some other industry issues. We'll be talking just a little bit about what companies are doing protecting clients and caregivers from the coronavirus, how companies are dealing with shortages of personal protective equipment, some thoughts about operating remotely, and we'll also be looking at recruiting, interviewing, and onboarding of caregivers during this time of working remotely. In terms of personal protective equipment, many of the members of our mastermind groups have found providers of equipment, they found resources. Some are still challenged with finding enough personal protective equipment. Others are in a little bit better shape than they were a week ago. Jill's put together a little poll, and we'd like you to just click on the link and give us your response. Jill, do you want to access that poll and see what happens here?
Yep, let's test it out.
All right.
I'm going to launch it and we'll see what happens.
Okay, very good. So there you have the poll. So take a moment. The question is, what are you or your company, or where are you and your company in acquiring enough personal protective equipment for your employees and caregivers? And you've got three choices and then other. We haven't been able to procure PPE for 100% of our caregivers. We're able to procure PPE for 100% of our caregivers and are absorbing the cost, or we were able to procure PPE for 100% of our caregivers and clients and are passing costs along to clients. And so people are responding to that poll right now.
Let's see if I can, oh, I don't know if the chat box is going to work. Sorry. I turned it off for our the kids, and now it I don't know if it popped up for everybody or not. Sorry about that. Maybe we can just unmute, like if you have an other, maybe we can take a minute to unmute and see what the other means.
Good. It looks like everybody's responded. Let's go ahead and end the polling, and I think that will display the results. Is that right, Jill?
I think so. Said 56% voted. Okay, we'll end it and see what happens. There, can you see?
Okay, so there we have the results. 67% of people say they have enough PPE and are absorbing the cost. 11% said we don't have enough. 11% said we have enough and we're passing along the costs, and then we have others. So we'll be interested in looking at that.
Okay.
And I guess the results came up on the screen. We're learning this new technology of polling, so thanks for your patience with us today. We're trying to learn how to use new stuff.
Okay, so I will stop. Oh, did it go away on the screen?
Yep.
Okay.
Okay, very good. Well, good information. And we are going to continue to share information. If you're looking for personal protective equipment, my recommendation is that you go to the Home Care Association of America resource page. And they have identified some vendors that are reliable vendors based on testimonies of HCAOA members. And they do have PPE available. That's at hcaoa.org. And click on the COVID resource page. The other thing we've been following along is the development of policies and procedures for protecting clients and caregivers. And there's a brand new set of recommended operation protocols that just came out today from the Home Care Association of America and Littler Mendelson, the law firm that works closely with HCAOA and the National Association for Home Care and Hospice. And so I would encourage you to go to the HCAOA webpage. They put together a medical panel of different home care companies that are members of HCAOA, and Littler Mendelson facilitated that process, and it's about a 19-page document. And I downloaded the document, and one of the things that's right on the front of it is a list of recommended operational protocols. And I've highlighted some of the things that are in there. A few of them you can see on this slide. But one of the things they're recommending is to really keep apprised of the current guidance from the Centers for Disease Control and Prevention, the OSHA, the Occupational Safety and Health Administration, as well as your state and local health department. So as leaders, it's important that we stay connected to those resources. It's also important that you provide updates to your staff as the situation changes. And I know early on, we shared ways that different companies were sharing information with their staff, whether it's daily emails, texts, video presentations, or Zoom meetings like this. So depending on where your staff is located, and of course most of them are probably working from home, keeping them updated is going to be really important. Also providing ongoing staff training, particularly for caregivers, and documenting this activity, things like hand hygiene, infection prevention and control, use of personal protective equipment, and infectious and communicable diseases. One of the things that we learned from the webinar that's done every Thursday that's presented by Littler Mendelson in cooperation with the Home Care Association of America and the National Association for Home Care and Hospice, is that if you allow your caregivers to use the N95 respirator, it is required that you provide them some information. It's called Appendix D from the OSHA manual. And so if you are allowing your caregivers to use the N95, it's more than a mask, it's technically a respirator. There is this Appendix D, and it's attached to this document from Littler. So I would encourage you to do that. If you are requiring N95 masks, then there's a different set of information that you'll need to provide for your caregivers, because there are some potential respiratory problems that can be exacerbated when your staff wear the N95 mask. So I would encourage you to get up to speed on that. There's also information in this protocol on screening clients and or patients and other household members. And so it gives you some very specific steps to take to screen clients and caregivers on a daily basis. There's also a lot of emphasis about what some of the software companies are doing to help you screen your caregivers before each shift, requiring them to check in and go through the screening questions, and in some cases take temperatures before they go on to a shift. And then also maintaining a written record of this screening process. There's also some information in here on developing plans for things like maintaining PPE levels, advising and referring direct care workers for medical attention when they exhibit fever or sore throat or other symptoms, continuing client or patient care should a large proportion of the staff become sick. So there's a number of areas where plans need to be developed and communicated in responding to some of these issues. and then developing and updating some practices such as addressing how the agency will respond to an employee with a communicable disease, the care and management of a patient or client with a communicable disease, having an emergency preparedness plan. This is one of the areas where we found many agencies did not have an emergency preparedness plan, and some of them are developing them, and we've shared some templates with our mastermind members. Having infection prevention and control policies, having a policy and procedure for telecommuting for non-direct care staff, and also how you're going to respond to the Family First Coronavirus Response Act. We got a lot of update. We'll talk about that more in a moment. So these are some tips and guidelines, and I would encourage you to go to HCAOA and download this recommended operational protocols from Littler. This is a list of some of the companies that participated in developing those protocols. I won't read them all, but a number of the franchise companies, a number of the large independents like Biata, home care and 24-hour home care. So this was a pretty significant group of companies, all of whom we know and have worked with, who have come together to put together this list. So it's a pretty exhaustive list. This is a list that we shared with you last week of the policies that you need to have in place. It probably is repetitious from some of the lists that I just read to you. So again, if you need some ideas and suggestions on the policies and procedures that you'll need to have in place, these are some of the things that you could use as a guideline. At Leading Home Care, we've continued to provide some resources for you in terms of managing and operating your business remotely. There's an article in our blog at Home Care CEO Report on helping your office team members work remotely, some things like setting up a specific space, having a specific schedule, some other guidelines that will help your office staff operate remotely if they're not accustomed. As a owner or CEO or leader of your company, you're probably quite accustomed to working from remote locations, but your office team members may not, so there's some tips in there. Also this week, my wife and business partner, Elizabeth Jeffries, wrote another article on leading in times of uncertainty. This is part 2 of a 3-part series that you may find helpful. So again, go to leadinghomecare.com and click on Home Care CEO Report, and you will see those articles. The other thing that we have been putting some fair amount of time and effort into in the last 2 weeks is really looking at this whole issue of caregiver recruiting and retention during the crisis, and perhaps more importantly, after the initial crisis is over and we get back to work. Initially, we're seeing some data that suggests that as the unemployment rate has gone up, as people have been laid off or no longer able to work, that they are in fact looking for work and replying to job ads that are out there online. And also we're seeing more referrals from employee referral programs. So I would encourage you to give some thought to the things that you're going to be doing. And we've been working on updating and rebuilding basically our caregiver quality assurance program. And we're coming out with a 5-phase model to help home care companies deal with the caregiver recruiting and retention crisis. It starts with the caregiver quality company culture. All of our research suggests that the company culture in your organization is going to have a huge impact on your ability to recruit and retain caregivers. And so we're developing some new material to help you craft the culture that you desire. And then we're building 4 systems Each of them is a 7-step system, and we'll be providing lots of content and information in the coming weeks. So we have the caregiver quality recruiting system, and this is based on some research that we've done over the last couple of years. We have the caregiver quality selection system, and this really goes back to 2006 when we did our initial caregiver recruiting study and came to the conclusion that while recruiting is important, selection is really the key. And so we're digging back into that and doing more work in helping you do a better job of selecting applicants, because if you get a large influx of applications, selection is really going to be important to help you pick the very best people. Also, the caregiver quality onboarding system is designed to help you look at your onboarding process and fill in the gaps and make sure that your new caregivers are having a quality experience as they join your company. And then the caregiver quality retention system, as you know, we've been doing a lot of work around retention. As retention continues to be a problem and turnover reached 82% last year. We're waiting for the results of the 2020 home care benchmarking study from Home Care Pulse. It'll be interesting to see what that data show, but one of the bits of data we've been working on the last 2 years is that 90% of retention problems happen in the first 90 days of employment, that the greatest turnover happens in those first 90 days. So we've been working with a number of our mastermind companies to look at ways to address that 90-day turnover issue. So we'll be having more information coming to you as we pull together the details of the Caregiver Quality Assurance Program. Last couple of weeks, we've been talking about the Family First Corona Response Act and the issue of emergency paid sick leave and emergency paid family leave. And we got some new information on this just today that indicates that while healthcare providers are exempt from the requirements of this law, a lawsuit by the state of New York against the federal government, against the Department of Labor, brings that exemption into question. And so what we're seeing across the industry is that many companies are waiving the exemption and go ahead and putting together emergency paid sick leave plans and emergency paid family leave plans under the guidance of the FFCRA. And so we're going to continue to stay on top of that. The information we're receiving suggests that the biggest danger from not implementing this act is not from the Department of Labor or other parts of the federal government, but it will be from plaintiffs' attorneys who are already lining up to begin looking at initiating class action lawsuits. And so there's a lot of information out there being developed to help protect you from class action lawsuits. We're not a law firm. We don't even want to pretend to provide guidance in that area, other than to encourage you to talk with your employment attorneys or reach out to the folks at Littler and gather the information that they have available. We are in the process of working out an arrangement with Littler to gain access to their package of resources, both for home care specific employment law and for the COVID program. We'll know more about that. We have a meeting with them next Monday. So we'll be passing that along to you as we get more information. And then the other is the Paycheck Protection Act. I haven't looked at the news in the last couple of hours, but I know the bill is in Congress, and hopefully that will be passed today or tomorrow. It brings another $484 billion of relief. That includes $320 billion to replenish the payroll protection plan. A survey conducted by the Home Care Association of America this past week showed that 90% of the people who responded to the survey had applied for the payroll protection plan, and 47% had been confirmed as approved or had received their funding. And with our home care mastermind groups, I would say that the numbers are probably very similar to that. We didn't do an official study, but I would say most of our members have applied for PPP, and half of them or so have received confirmation, and many of them have already received the funds. So with this second round, we're encouraging folks to work with your own banker and go ahead and complete that application and get that submitted so that when the funds are released by Congress to replenish the program, that you'll be in line and have a relationship with your banker to make that happen. So those are the hot spots that we've been talking about. Yeah, I see, Jill, we don't have the
chat box.
Chat box to put questions into. So
Sorry.
if you have a question, what we're going to ask you to do is go ahead and unmute yourself. And if you can turn on your camera so we can see you, we'll be able to take your questions. We'll do our best to respond to that. We do have one of our mastermind members, Glenn Lane, with us, who was with us last week and has agreed to come and share some insights. He's done a lot of research on that. Glenn, what are your insights on any of those topics that we've been covering? The policies and procedures, the Family Leave Act, the Payroll Protection Plan.
So just, I guess, one little, just add on to one of your other earlier topics. I've been spending quite a bit of time on the recruitment and the automation and kind of removal of paper and as much personal contact as we can from the recruiting cycle. And I mean, there's lots of things out there. You can cobble something together yourself. And then there's also platforms that are designed specifically for video recruiting and paperless onboarding and, you know, virtual education and things like that. So I think the number one thing is just to get going. And I think a lot of this, we're not going to unwind. This will be kind of the way we recruit going forward. There will be a skills review at the end with the nurse, but instead of it being one nurse and half a dozen people in orientation, it'll be one-on-one or one-on-two, you know, to get them ready to go and get them, you know, get them onto their first case. I think the Littler meetings are very, very helpful. I'd really encourage everyone to attend them. They're Thursdays at noon Eastern. There's recordings of the prior ones, just tremendous amount of information. This whole concept of waiving the exemption, you know, so the industry fought hard for it, but it is very labor unfriendly. At the same time, people are concerned about depleting their workforces. I think the good thing is, even though I feel I'm going to waive it completely, you could waive parts of it and still, you know, stand by the exemption for other parts of it. But on the face of it, there isn't a financial cost to waiving. It's more the ease with which your workers could go ahead and kind of opt out of working. And then I guess on the PPP, which hopefully we're going to see the House approve it tonight, President sign it tonight or tomorrow, just a tremendous amount of noise around people that were really disappointed by their larger banks and some either smaller banks or niche banks that are SBA lenders at their core really came through. So it'll be interesting to see. I have a lot of friends debating, you know, they're in the queue with their bank. They say they're at the SBA window. Some of them even say they have SBA numbers, which is something I don't understand, how they could have an SBA number from round one and not have gotten funded. But I think a lot of people are kind of applying to a second bank as a backup just to see if maybe these smaller banks, you know, can get more progress. It's going to go quickly, and I think there's a big queue kind of waiting at the window for when the funds start going out again tomorrow. I think those are the biggest updates. I think there's a lot of also thought and angst around what's exactly going into forgiveness. Full guidance still isn't out there, although there's enough and there's a logic to it that you know, especially if people have gotten their money, the clock is starting, the payrolls are by payroll date. From when you got your money, the next 8 payroll dates are really what counts. And then also there's different head count FTE counts also that kind of go into that, just to make sure you're kind of not back end loading it. You're not kind of overpaying a few people to kind of meet the criteria. So a lot of thought went into it. Similarly, a lot of thought, I think, went into the paid sick, paid family leave, and extended family leave components in terms of the logic of the way they're getting the money to the business owners with the reduction in your tax deposits. So that also was very kind of pleasant to see. It really took me back to see how quick it was happening.
Yeah, the emphasis on the waiving of the family leave thing and the potential problems that created was something that the Littler folks talked about today that I think we all need to be aware of. The other one that you mentioned, Glenn, is the forgiveness of the PPP loans. And one of our members on our 5% group last week cautioned all of the members of that particular group to really pay attention to the regulations and the information that come out from the Small Business Administration about the forgiveness of those loans, because apparently with the pushback of all of the big companies that got money, there will be a significant amount of investigation and auditing of companies. So if you got payroll protection plan money, you want to make sure that you're well covered and documented and that you understand the provisions of the law and of the regulation and of what's going to come into play with regard to forgiveness. So that'll be an interesting one to watch as well. The other one that the attorneys warned us about were these class action lawsuits, and already there are things beginning to percolate. So I think that's a big concern for everyone. Dave Rogers is with us from Phoenix, also a member of our top 7% mastermind group. Good to have you with us, Dave. Do you have some insights into what you've experienced out there with your company?
Well, it's been a day of webinars. Kind of an information overload, but no, we are still waiting for our PPP funds via Chase. We are approved by them. We do have a number, but I don't think it's an SBA number, Glenn. I think that's what a lot of people are confusing it with. They will dump in to the SBA tonight, tomorrow, whenever it opens up. But some insight from an associate whose brother works at Bank of America is they're expecting the overload of apps that are ready to go to almost crash the SBA, if not use up the funds within a matter of hours. So, but we'll see. It is interesting that this and earlier webinars all said about 40 to 50% of the people on them had gotten their funds. So if that's the case, and that was 350 billion, the second 300 billion might be close to what's needed. Who knows, you know? Wishful. I'm hopeful, but if not, there'll be a third round. It'll just take another.
Well, and they've labeled this law PPP 3.5,
yeah.
And they're already anticipating a fourth round of support. So it'll be interesting to see how that all develops over the next weeks and months.
Yeah, they said that they estimate, or early on, a few days ago, I remember they were saying it's going to take about $1 trillion of PPP funds to satisfy the need.
Yeah.
So, no, we are, you know, we're blessed in Arizona. The heat's coming next week. I don't know if that will help. Our state is doing okay. We did have a tragic report 2 days ago on Tuesday of one senior community that lost 13 residents. And ironically, that community had reached out to us a little under 2 weeks ago, asked us to help them staff some memory care shortfalls, because we do that. And we asked if they were positive. They said they had 2 positives in assisted, none in memory care and none in the staff. And we still backed away because we weren't going into any positive environments because of the cross use of caregivers at facilities and at clients' individual homes. And then 2 weeks later, they've lost 13 residents, and they have a 28% others are positive. That was kind of shocking. I was grateful we did say no, and that was Littler that convinced us to say no.
Okay.
So, besides that, we're cruising along. We're down 10%, maybe blessed a little bit more than some. March and April over January and February. So we're grateful. There has been an uptick in the last 2 weeks of activity, referrals, intake calls. We do virtual intakes now. And you know, I got my EIDL check on Friday for $10,000. That was nice, and that's free money. You don't have to pay it back.
Good. Great. Thanks, Dave. We're going to go across town to Tom Glatt, who's also in Arizona. Tom raised his hand. Tell us what you have in mind, Tom. Or what
he got his PPP money already. He was already bragging earlier on a webinar. So.
Oh, we're not hearing you, Tom. Oh.
Here.
Okay, now go.
Okay, so I'm unmuted now. Can you hear me now?
Yeah, we can hear you.
Can you guys hear me?
Yeah.
Okay, good. Yeah, so, you know, I count my lucky stars on the Chase thing, because with Chase, I applied right at the beginning. Of course, I couldn't apply till Monday till they had their systems together. And then I didn't hear anything until Wednesday that night. They said they're almost out of money. And I got notified at 1 o'clock in the morning on Thursday morning, and then got funded on Friday. So it was pretty quick when it happened, but no doubt there was a lot of anxious moments. And I think with Chase now, I think they're telling people you're at phase 3. I've talked to a couple other people that at least notify you that we're just ready to submit it. So we'll see. You know, along with the PPP, our agency is a little bit different because we actually have home health care. So we have physical therapists, occupational therapists, and nurses on that professional side. And we're feeling the same kind of pain in the facilities that they just don't want us in because they don't want to have that risk. And one thing I don't know if you guys are aware of, but just recently CMS has basically is giving the facilities a heads up that they're going to be needing to mandatory report not only to your state group, but you also now need to report to CMS. And basically they have to notify everybody in the facility if there's a COVID patient. And then there's also some questions on exactly when the next COVID patient's identified, how much do they have to notify the patient and the families. And plus they're supposedly in the regulation I saw, it says CMS is going to make this public. So it's going to put a pucker factor on the facilities, and they're going to, you know, I don't know when we're going to get much time in there. I mean, we have some success, but in general, it's difficult. I think, you know, one of my biggest concerns, and I know, Glenn, you've mentioned this on previous situations, regarding the forgiveness of the loans for those that ultimately get the PPP plan. I mean, with my administrative staff in the office, I've got them retained. Their head count's going to stay. The pay is going to stay the same. But how this gets applied to private duty, when there's that turnover you mentioned before, and some people are just going to opt out for a while and like, well, I'm going to stay home for a couple months and maybe I'll come back. And how do you do all that calculations? Because when they put the regulations together, the legislation, you know, I don't know how much they think about private duty, and the clock is starting like Glenn's mentioned. And so, you know, kind of my big heartburn is, how do I maximize that not only for my employees, but also on the back end? How do I make decisions that are going to be of benefit to everybody? And I don't have a clue yet. And if anybody else has a better understanding, I certainly would like to know.
Yeah, so I guess a couple of things I would encourage everyone, and I know a percentage of us have it, percentage of us don't. So first of all, there's 2 testing periods for the FTE component of this. February 15th to June 30th of 19, and then Jan 1 to February 29th of 20. So I would pull your weekly, in paychecks it's department summary, but your head-by-head payroll report for those periods. There is the concept of an FTE, so it's not just the number of people getting paid. Some places it says an FTE is 40 hours, some say it's 30, but realistically it doesn't matter. If you use, as long as they've got the concept of FTE, which they do, and you use that divisor across the 2 testing periods and across the period, the 8 weeks following getting your money, that will give you a sense of where you are. So you've got your loan, the bar is 75% at least of the loan needs to go to payroll. So that's a knowable weekly number that you can monitor. And then the FTE counts, you can take the most favorable of those 2 test periods as far as the average. It's going to be average monthly in the end over the 8 weeks. But in the end, the most favorable, the period in 19 or 20 where you had the least number of FTEs, that'll be the denominator, and then your average of the monthlies during the 8 weeks will be your numerator, and that will determine what percentage is forgiven or not, assuming you meet the 75. So there's some other things in there around, people's variability and people's pay rates and things like that I think are going to have less of an effect on us. But so I did do a you could call it a bonus or a hazard pay for 8 weeks of a certain amount per straight time and overtime dollars for the caregivers. I did something for my office staff as well. I'm spreading it out over the 8 weeks. There's no lump sums. I want to keep it very, very smooth. And at the end as we get into that second month, we can see kind of what other calibrations we're going to need to do. And in the end, it's the numbers are not that manipulatable. The worst that happens is some percentage of it is not going to get forgiven, and it's a 2-year loan at a point. So.
And did you go back to just the law itself? Because that's what I guess I just need to go back and start reading the details. I've certainly got the highlights, but it's like, that's still not going to give me the answers.
Yeah, so that section 1106, which is around the forgiveness, is really the details, although there's still a lot of interpretation to be done. In the end, the bank you worked with is going to be the one you're going to, I don't even want to say negotiate with, you're going to provide the documentation. It'll be interesting to see how much variability there is bank to bank in terms of, what all their approaches are. But it's a tremendous undertaking. Just forgetting about us pulling together the documentation and understanding it, them digesting it at the volume that we're, talking about here is huge.
So is it your understanding that the bank is going to make the final decision on what you're going to get forgiven?
Yes. Yeah, everyone is making representations up the line. So we're representing to the bank of the integrity of what we're providing. The bank is representing to SBA that they've kicked the tires enough on this, and they're meeting the guidelines that they need to meet.
So it is your understanding, Glenn, then that the bank will be the ones doing the auditing, sort of the post-event auditing of this, or will the SBA be doing that, or the IRS? Do we have any sense of who the auditors might be?
We don't, and it's interesting. So the term auditing is not in any of the official verbiage. A lot of it is based on these certifications that people are making, and obviously somewhere that's got to be tested, whether it's like some sort of investor in IG sort of functionality where there's, an SBA inspector general or someone else that's kind of going to be testing this, or the press is just going to torture people, like these restaurant groups, or it could be one of us, who the hell knows, but a lot of this is just based on the certifications that everyone is kind of making to each other.
Right. But then each of us will have to provide information retrospectively of what we did with that money, and does it fit into the categories that are forgivable. Is that right?
Yeah. Now, again, they're not tracking dollars. So one, I think we're blessed as an industry in some ways, even though we all have tremendous risk to our businesses, that they're not saying that the actual dollar that you got from PPP, that dollar needs to go to this. If you had dollars from other sources that could cover some of these things, it's more that you did cover these things. You didn't lay people off. You maintained your business. You kept people off unemployment, and and all of those things. So it's more, you got a loan for X. Did you spend the X the way it was supposed to be spent in a way that was deemed forgivable, regardless of whether you had other funds available or not? The other thing I am trying to do is build out a bench of folks who I'm paying to stand by to be available as the workforce depletes. So every week we're dealing with exposures and questions and pulling people off the line for different periods of time. I want to have backups for those folks that are ready to go. And also I want to have folks that are ready to go to staff the new cases that are coming on. And we are seeing a lot of inquiry activity. And somehow, even with the drop in hours and what you thought was a bench, quote unquote, we're still having some trouble staffing, and I want to try to button that up a little bit more. And again, that does go to some of your salary numbers and, you know, in the like, you know, for the forgiveness.
Okay, thank you, Glenn. Any other observations or comments or questions? If you'd like to comment, unmute yourself and talk to us.
I'd like to give some other feedback too. I know Glenn, this is not a Tom-Glenn conversation, but I know Glenn, it seems like you've been kind of on the leading edge here of making some smart decisions. We have made the decision to not take the exemption. And so, you know, that causes a headache for my HR department to, you know, and we're getting a lot of unemployment, but there are people that maybe they maybe went to orientation a year ago or 9 months ago, and we almost forget, they're like an asterisk in our employment, but they're, you know, being tagged to us. But so we are losing a few people to unemployment because they just are not, I don't know, they claim that they don't have work. But the other part that I thought maybe I'd get more of is the FMLA. And so far we haven't really had much hit on that. So it's not been that difficult to administer.
And I think the beauty of it is really the payroll companies have done a nice job getting set up for it. You have the burden of identifying the people that are eligible for it, whether it's people that have exposures that can't work, or taking care of someone that can't work, or in the extended FMLA, there's a longer issue of child care or something there. But you use the pay codes the payroll companies provide. The money gets paid to the employee that payroll period, and your deposit is reduced the next week. I agree with you on waiving the exemption. I'm there. I'd rather beef up my recruiting, risk the depletion of the workforce, but do the right thing by the people that really need it. The other thing, and I kind of had a very frustrating day with this today as well. There is this underlying thing with unemployment. In New York, it's $1,104 a week that they can get by going on unemployment. And they're holding this over my coordinator and some of my HR people that I'd rather just go on unemployment. I said, okay, I'm offering you 40 hours a week at $15 an hour guaranteed. That's an offer of employment. You're now turning it down. I'll do everything I can that you're not going to get unemployment. You're turning down 40 hours a week. And again, it's going to be tough. The system is very bogged down, but I don't want people to think it's so easy to get the 1,100.
Good point. Thank you. Thank you. I'm going to jump out to Fort Worth, Texas, and call my friend Dale Brock, who's sitting there. Hi, Dale. How are you today?
Doing well, Stephen. How are you?
Dale, you're part of the Visiting Angels organization. What kinds of insights are you getting from your franchisor that is helping you deal with the crisis?
You know, they've partnered, Steve, with Stephen Littler. And so early on, we got some Littler webinars with them, which was very helpful. And internally, I would say they're more focused on the operational protocols, keeping people safe, that sort of thing. And of course, at the top level, they've been very active in, you know, lobbying for the exemption, and now taking a few steps back and recommending that people either not claim it or only partially claim it. So that's been a moving target, but they are trying to keep a pretty close pulse from an industry perspective on what's going on, trying to influence what does go on.
And what are you seeing there in the Fort Worth market, Dale? And how's it affecting your agency?
We're probably off in hours about 35%, and somehow that translates to about 40% in gross revenues from January, what they were running in January to today. So it's been pretty significant for us. Yeah. I'm going to ask and see if any of the group was familiar with the emergency disaster loan. It's a long-term loan at not, from a cost to capital standpoint, I think it's either 3.5% or 4%.
Right.
Yeah. Or, yeah.
And I don't know anything about it, what the use of funds could be for, if you could refinance things with it, or just a source of long-term capital. I don't know if anyone knows anything about it. I don't think it's collateral dependent. If collateral is not available, I've heard that that's not an impediment to getting one, and no personal guarantee. So I didn't know if that'd be a interesting way to get some long-term capital in this situation. It's normally not available unless it's a physical disaster or a hurricane or something like that. So this is the first time I think they've opened it up to a pandemic or something like this.
Tom, it looks like you're familiar with that. Do you have some thoughts for Dale?
Well, the only thing that I did when it first was announced, I sat on it with my CPA, and he's had some previous experience with the SBA, and he was pretty negative at the beginning, just like, I'm sure there's going to be a lot of gotchas. This can't be that easy. And at the end, he's like, that's pretty easy. So he was very surprised on just how easy it was to qualify. And again, it's around 4%. It may have been at 3.75, but for us, I decided to, the PPP is 1%. So, for me, it was kind of like, hold my cards until I had a better idea of what was available. But, clearly if that's the PPP is not available and that's the right fit, I mean, 4% longer term is a, pretty cheap money. It's cheap. Well, I don't know what the banks are now offering. If you got a line of credit, I know with the prime going down, that may be around that same amount, but it was pretty easy. It was remarkably easy to apply for.
And is that also through the SBA, Tom?
Yes, it's right to the SBA. I even think it's the SBA 7 program. It's all in that same umbrella.
Okay, good, very good.
You get $10,000 kind of instantly, with really no strings attached. I think you just get a check for $10,000 kind of as an interim measure while they're looking at approving your loan. That would become part of the loan. But the 10, the requirements, if a small guy just needed 10, the requirements are almost nothing to get the 10, and you don't have to proceed with the application for the remainder of the loan. But
I must have missed that, because I thought the 10 you actually had to have a 50% deduction in income or something much more catastrophic. So I'm learning something new here. If people are being able to apply and qualify for that.
You may be right. I haven't studied it. That's why I was asking the group if anyone had looked into it or taken a step toward applying for one. And I'm not sure what you can use the money for, what the permitted uses are.
Well, like I said earlier, we got the 10, and as far as we can tell, there's no strings attached. And so, Tom, you gave up 10 grand, but you can still get it.
Yeah, I'm not. Let's look at the other way. I'm aware that I can get 10 more. So, yeah, thanks for that. I'll have to take a look.
To your point, Dale, I think the SBA, if the PPP doesn't come through and you're in the need of capital, it doesn't get easier than the new SBA, because there's no personal guarantee like the normal SBA.
I noticed in this tranche of relief money, there's a big chunk going into that program too. Out of this.
Yeah, it's a sweet program. But PPP is
what amazes. Yeah.
Theoretically,
ahead,
part of it's going to be free, right, Tom? How much?
Well, let's hope. So, it's interesting. They thought with this flood of everybody's kind of at the gates, kind of like, waiting to go into a sporting event, and everybody's just pushing their way, trying to get in line. And it'll be interesting to see the flood. I think my CPA thought, there should be enough money for a lot of people, but I think 60 to 70% of the money that went to the first group went to companies that had shareholders that, significant assets. And so this other one hopefully will last longer, but I read in the Arizona Business Journal, they said that they say it may only last for 4 days. So who knows? I wish everybody the best on this.
Well, and we looked into the big company question because people were pushing back saying, well, gee, all this money went to all these big companies, Ruth's Chris Steakhouse and Shake Shack. Well, it turns out there was some lobbying by the hotel and restaurant industry to Congress when this first round was passed. And so some of the money was designated for the food service industry and the hospitality industry. And like a Ruth's Chris that has way less than 500 employees per location fit into some provision for the law. And what I haven't been able to get clear on, and maybe some of you know, is was the Ruth's Chris Shake Shack money out of the same bucket as the PPP for small businesses it was, Tom?
Yes.
Yeah. Okay.
Well, again, I'm not Mr. Know-it-all, but I thought there was just the same bucket. There was no from what I read, there was no specific qualifications that said it had to be so much for smaller businesses. I don't even think in the new one that it is there, but they're really making an emphasis that they want to have 5 or less employees in this little one, and so time will tell.
Well, 2 days ago, they were talking about putting some provisions in there for small and minority-owned businesses that did not have previous relationships with the lending bank.
Mm-hmm.
I don't know if that is making it into the final bill. Does anybody know about that? Yeah. Okay. Well, we'll get these pieces. And
I think it is in there.
I think it is in there. I don't think it's going to affect you going to your bank, though, or the size of the pool or anything like that.
Yeah. Okay.
Well, they're going to have to figure it out soon because everybody's going to want to get that money as soon as it gets approved. I mean, the other one took like 3 or 4 days before Chase even got ready for it. And that just causes so much more angst and anxiety on everybody's, perspective.
Right.
Tom, I saw Chase on a whole bunch of those loans. It looked like more than other banks. I was seeing Chase, looking down the list.
They were the largest.
And again, I'm not Mr. Know-it-all, but B of A, Wells Fargo to a lesser extent, but B of A had quite a few. I think B of A, if I was looking at who was going to give the stars to, I think they seem to get more in, or at least publicly proclaim that they did a better job.
So you guys saw a list by bank name and who got the money?
Well, no, this was in the Arizona Business Journal and maybe some other places that said, hey, we're processing 340,000. We've got 35 billion lined up for funding, and that's all. So I've not seen a total accounting yet, but there definitely will be one at some point.
Well, the Treasury.gov.
Where I saw it.
The Treasury.gov has it listed by bank, but they only list bank number 1, 2, 3 by size.
Yeah.
I think you can guess it's Chase, B of A, and then Wells, and I don't know who the rest are, but they do break it down by what size funds were given out and so on and so forth. So it's kind of interesting, but it doesn't say who. So.
Yeah, I think the average loan was $150,000 or less. So there was definitely a lot of smaller banks.
Yeah, it's 205,000 right now.
Okay.
It's the average PPP fund.
Okay. Good. Anybody else who has not had an opportunity to ask a question yet? If you have a question about any of the things that we've been talking about today, go ahead and unmute yourself and ask your question. Give you a minute to do that.
Who's getting staged to take COVID positive cases, or is anyone taking them yet?
I'm trying to remember the numbers, but of all of our 4 mastermind groups, I'm going to say 30% of the companies said they were preparing to or anticipating taking COVID positive cases. Most were saying they were not because they didn't have the adequate personal protective equipment. Glenn, you remember that conversation, what the recollections were?
Yeah, I think so. People are, I have got a tremendous amount of inquiries. I've made a decision not to take a new active positive, but I'm now ready to take an existing client should they become positive.
Yeah.
And then also I'm starting to see more clients coming out of, they're recovered, they might or might not have tested negative. Many of the hospitals and rehabs here are not testing them coming out, which is really interesting. But I have taken now a couple that are symptom free. The right number of days is correct, and I am doing N95s and gowns and face shields with those though for a period of time.
And have you changed your price point for those folks, Glenn?
Yeah, so what I did was the new ones that have come on, I'm charging a couple of bucks more. So anything that is short term where I'm relieving a private caregiver who they think is going to come back, so it's a shorter duration case than I would normally take, I'm charging more for. And then these cases in the rehabs or in the facilities for the clients that are recovering, I'm charging a couple of bucks more for. I've also started to pass on overtime, which I hadn't in the past as well.
Yeah. We actually had one of our members that has really geared up to take COVID positive clients, and any new clients coming into their system, they're making it very clear up front, here's the deal. And they're basically charging double of their basic rate for billing to the client, and they're paying their caregivers triple time. And the anticipation is that they will, if those caregivers are exposed and have to be quarantined, they'll continue to pay them for the 14 days of quarantine at that triple time rate. I think for existing clients that are exposed and test positive, the caregivers that are willing to stay in there, they're paying them double time. So they're putting some significant premiums on the rates, and they're finding, not an overabundance of people willing to take those cases, but people that are willing to take, and they have the PPE that they feel reasonably confident that they can protect those caregivers. So one of the things that we're seeing from our members is looking at how they're staying in touch with referral sources and looking at opportunities to generate new business. And generally the folks who have reached out to individual referral sources to say, how are you doing? How's your family? You're working from home. What's going on in your organization? What can we do to support you as an individual? And if you have cases for us, we are geared up. We have the equipment. We're prepared to take COVID positive cases. Those folks are seeing an influx of new referrals. We've heard some other examples of home care companies that are basically trying to do remote sales in the way that they've always done it. They're not getting a very positive response to that. So sounds like this is an opportunity to step back and look at how can we serve those referral partners that have helped us over the years to help them in their time of need, whatever it may be, and not get caught up in the dollars and cents piece of it. Any thoughts about that or anything that you've seen in your local markets?
Yeah, I'll just share a thought about Glenn, just kind of reemphasizing it. In my mind, if I've got a current client that has COVID, they're going to need care. And if I say I can't take it, Dave's going to probably take it next door, and I've lost my client. So the other economics to that is if you have somebody that you take them on, they may be a short term. They're going to be a pretty expensive, extensive, operational, et cetera, cost, and you may have them on for a week or two, and then they're going to be well, and chances are they're going to be going back to whatever they had before. They may be going back to Dave because or whatever. So I think the economics shows you that you need to kind of protect your own, and if you're going to find a way, you should take care of your people that brought you to the dance already.
Well, we did a survey of all our clients early on, and we found out that 20% of our clients are solely dependent on us for support in the home. They have no family, no parent friends, no one else to help them if they become affected by COVID-19 other than going to the hospital. And so we made a commitment with those caregivers and ourselves, and we're preparing that if any of those turn positive, we're going to take care of them so Tom doesn't get them. But the other 80 all had either family or friends or church affiliates or whatever that would step in and help them. So that was our initial thing. now we're staging to take care of people that are positive. We're just not quite there yet because we still need shields and gowns, but we're working on it.
The N95s is my biggest problem. Again, we're a home health care provider, and even the hospitals, we told the hospitals as a condition for us to take your patient's discharge, we'd be more than happy to, but we need to have N95 masks. I've seemed to be okay on other stuff, and I got the shields from Amazon. It took me 3 weeks to get them, but I got the shields. But the hospitals are basically saying, nice try, but we're not going to give you our PPE for you to take a patient.
Well, Tom, I think we're going to be able to get it from the state hopefully soon, though, because I think the state's going to end up having a cut. So,
is anyone hearing of rate increases to help pay for PPE, legal fees, paid sick leave, paid family leave, unemployment?
Guys, I hate to jump, but I got to run for 1 o'clock. So it's been great. You all stay safe, stay healthy, and be kind.
Thanks, Dave. Appreciate you being with us. To your question, Dale, we have some members who have looked and done some math and have added into their invoice a line item for personal protective equipment. And they're using basically the same number across the board, charging every client the same amount. There have been some others where when the client is COVID positive and they require a higher degree of personal protective equipment, then they've added some additional dollars into that. We also saw some companies that almost immediately when this thing started to percolate, raised their rates to their clients and raise their pay rates to their caregivers. A lot of the folks that are raising caregiver rates have made it clear that this is a bonus on top of their base rate, so that at some point when they need to go back to the original base rate, it's not like, well, we gave you a raise, now we're taking it away. It's, we gave you a bonus, but now that the crisis is over, although some folks have identified opportunities for caregivers to basically earn that new rate by making an extra contribution to caring for clients. Great point. Any other questions, comments? Yeah.
Well, just a comment I have is, you know, my next question is, when is this going to end? When are we going to have to stop wearing PPE in a client's home, the masks? And I just don't see that ending anytime soon. And the CDC now is saying, oh, we may have a big wave coming in the fall because of influenza plus that. And it's like, oh my gosh. So I don't know if PPE, that's just going to be another line item expense for the foreseeable future. And my CPA always says, never let a situation where there's the client, I think, Glenn, you mentioned this last week, the client is, if you raise the rate $1 or whatever it is, they're like, well, I could have expected that because I can see that my caregivers are wearing masks and my other things that are happening out there. It is a cost of doing business.
Yep, exactly right. Exactly right. Well, this has been a great conversation. We're just 2 minutes past the top of the hour, so we want to thank you all for joining us for office hours today. Hopefully this information has been useful and helpful, and we invite you to join us next Thursday at 4 p.m. Eastern Time for continued conversation. Thanks so much. Have a great day, everyone. See you later.
Thank you. Bye-bye.